The South African doctor who first sounded the alarm on the Omicron variant of the coronavirus said that its symptoms are unusual but mild in healthy patients, but she's worried the strain could cause complications in the elderly and unvaccinated. Dr. Angelique Coetzee, a practicing doctor for 30 years who chairs the South African Medical Association, SAMA, said she believed she had found a new strain of the virus after COVID-19 patients at her private practice in Pretoria exhibited strange symptoms. Their symptoms were so different and so mild from those I had treated before, Coetzee told The Telegraph. She called South Africa's Vaccine Advisory Committee on November 18 after a family of 4 all tested positive for the virus with symptoms that included extreme fatigue. So far, she's had 24 patients who tested positive and showed symptoms of the new variant, mostly young men. About half of the patients were unvaccinated, she said. None of those infected lost their sense of smell or taste. It presents mild disease with symptoms being sore muscles and tiredness for a day or two, not feeling well, Coetzee told the paper. So far, we have detected that those infected do not suffer the loss of taste or smell. They might have a slight cough. There are no prominent symptoms. Of those infected, some are currently being treated at home. She described one very interesting case involving a 6-year-old girl. She had a temperature and a very high pulse rate, and I wondered if I should admit her. But when I followed up 2 days later, she was so much better, she said. Coetzee emphasized that all of her patients had been healthy, and expressed worry that elderly or unvaccinated patients could be hit by the Omicron much harder, especially those with comorbidities such as diabetes or heart disease.